Skin cancer in general is classified into two different categories, melanoma and then what we call non-melanoma skin cancer. So non-melanoma skin cancers are everything else that are not melanoma. This includes basal cell carcinomas, squamous cell carcinomas, those are the ones as a general sense. There are other rare types of skin cancers, things like Merkel cell carcinoma, which got a lot of news and press in the past year, as well as different kinds of dermatofibrosarcomas, different rare things that people don't know about. But as a general category, melanomas are skin cancers that can be deadly. That is what we worry about, metastasis or spread throughout the body when people need aggressive therapy or chemotherapy, different things like that. Non-melanoma skin cancers, typically we can cut them out surgically in the office as long as they're caught early. For melanomas, there is more of a genetic component. So melanomas can arise on their own if someone has a genetic predisposition and gets a lot of UV exposure. If we catch them early, we can cut them out in the office, depending on the depth of the melanoma. So we categorize that based on cancer screening and guidelines. So if it's a very thin melanoma, it can be cut out in the office. If it's deep and invasive, then we need to check lymph nodes and intervene a little bit further. Interestingly, redheads are actually more susceptible to melanoma. We all have a gene called the MC1R gene, and this is a gene that controls melanin production in our skin. Melanin makes pigment. It's what makes our skin colored or brown. So redheads have a variant of that gene, and that explains why they have different pigmentation, and because of that, they're actually more susceptible to these melanin-related skin cancers. Melanomas can also come from abnormal moles. So a mole on the skin can be normal, and then with enough UV exposure and a genetic predisposition, it can convert from a nevus into a dysplastic nevus and then rarely can turn into a melanoma. These non-melanoma skin cancers, like squamous cell carcinoma and basal cell, come from chronic sun exposure. So years and years of sun exposure and sun damage, and then these skin cancers pop up. As a general sense, they tend not to invade. They tend to grow locally, so wherever they are, whether it's head and neck or on the sun-exposed areas of the body, they continue to grow and invade very locally. And this is the reason why we need to sun protect, so that we can avoid all of these kinds of skin cancers.